There is your fill-in sheet and section 2. So gerbils are used for some very specific types of research, including radiation, stroke, and epilepsy. They're used for epilepsy because they are prone to seizures, so we'll talk about that a little bit in clinical. What type of gerbil do we use? The Mongolian gerbil is the most common species used. Gerbils are a little unique, so dental formula is the same as the other rodents. No canines because, again, not a carnivore. No premolars. They have incisors, they have molars. Those hypsodontic incisors are going to be the thing that makes them a rodent. They're a small animal, 50 to 60 grams. They can live 2 to 3 years. Body temperature is a little warmer, 100.7, 260 to 600 heartbeats per minute, and then 85 to 160 breaths per minute, which is a little lower than some of the other species. But here's where it gets fun. Look at that water consumption, 4 mils per day. They do not drink much water because they were born in the desert. These are desert rodents. They eat about the same as any other animal of their size, about 5 to 7 grams a day. And then the other really impressive thing is their lack of urine output. They don't produce mils, they produce droplets of highly concentrated urine. That is 100% normal. Sexing, same as mice, longer anogenital distance. You may or may not see their testes. You will see the dark pigmented scrotum, and they have an orangey brown sebaceous marking gland. That's new. The females, that shorter AG distance, nipples, and they also have small marking glands. There you go with the female, short AG. There's the very pigmented scrotum of the male. There's the prepuce. There's the anus. They're going to hit sexual maturity at 70 to 90 days. They have a short estrus cycle, 4 to 7 days. Unlike the other rodent species we've talked about, when these guys mate, they mate for life. They are monogamous, they are pair bonded, and it is very difficult to form new pairs. Gestation's longer than the mice, 24 to 27 days, 4 to 6 pups, and they can be weaned at about 25 days, so also longer than mice. When it comes to husbandry, there's no specific regulations, like gerbils aren't used a lot, but they do like to be able to have a species normative height requirement. So rat cages are ideal so that they can hit that height because they like to have a bipedal stance, just like rats. One thing that is required is sand bathing, just like with chinchillas. It prevents oily, matted coats. What are their species' typical behavior? They burrow, they explore, they chew, they do intense active periods, and then sleep, sleep, sleep. They are a social group. They like to be with their friends, and unlike some species, fighting is uncommon. One thing to note, they are excellent jumpers. They can jump much, much higher than their body. And they are scent focused, so scent is a very important element. When it comes to clinical, we have non-pathogenic, malocclusion, nasal dermatitis, tail slipper degloving, and epilepsy. Malocclusion, we've talked about that. Nasal dermatitis is a little bit unique for gerbils. It's also known as facial eczema or sore nose. This is an increase in secretion of the porphyrins by the hydarian gland. The chromodiachuria spills out onto the skin and causes a skin irritation. This can be stress-related, this could be illness, this could be because there is too much humidity in their environment. These are a desert animal, and it has a secondary staphylococcal infection component. Clinical signs is that paranasal erythema, localized alopecia, and extensive moist dermatitis. Treatments alleviate the stress, prevention. You can do an Elizabethan collar. Yes, they make them for rodents. Clean, dry bedding is very important, and then maybe using sand or soft clay instead of an abrasive wood chip. It's important to clean those lesions and then use a topical or parenteral antibiotic, but not streptomycin because that is fatal in gerbils. Prevention is the best strategy though. Alleviate that stress, reduce the humidity, and then clean, dry bedding is going to be very important, as is not having sharp objects in their cage and ensuring that you are giving them access to sand baths. Tail slip is another unfortunate condition that we see with gerbils. This is literally a degloving injury. Do not pick gerbils up by the tip of the tail. Do not pick them up by the distal half of the tail. Try to avoid picking them up by the tail altogether. Treatment, unfortunately, is amputation and then allowing it to necrose and slough off. Epilepsy is a serious concern with gerbils. It occurs in 20 to 40% of gerbils, and you can see the onset as early as 2 months of age. This is hereditary. They may outgrow the condition. There is no effective treatment. Pathogenic diseases. Clostridium piliforme, aka Tizard disease. We talked about this a little bit in some of the other species. Tizard's disease is the #1 fatal infectious disease of gerbils. This is something that we will see sudden death, maybe a short illness. It's something where you will see diarrhea. It's a fecal oral transmission. The treatment isn't always rewarding, but you can try supportive fluids, doxycycline, trazodone, flagyl, and then decontaminating the housing because Clostridium is going to just be living in there. If you do necropsies on animals after they have died of Tizard's disease, you'll see hepatic and intestinal necrosis. Parasites for gerbils include the dwarf tapeworm and, our good friend the tropical rat mite. Is that a fur mite? You tell me. Dwarf tapeworm is something that you might see with them. If they present with diarrhea and dehydration, it can be treated. However, the tropical rat mite is something you might also see, which is zoonotic, and again can be treated with selamycin. There's your gerbil chapter in 10 minutes or less. Let me know if you have any questions or if there are any problems.